Hey everyone, Dr. Sonal here, board certified allergist, bringing you a new sub-series of mine, Allergy and Immunology for the Primary Care Provider. So if you are a pediatrician, family practitioner, internist, someone who does primary care, whether you're a doctor, DO, NP, PA, this is for you. Quick little bites on things related to allergy and immunology that you can hopefully use in your practice. Most of us don't have time, unfortunately, to listen to some of these longer lectures, whether they're on YouTube or podcasts. So let's go with quick little bites that you might be able to quickly scroll through or listen to, and hopefully we'll add some clinical insight into some of the patients you see all the time, because allergic diseases are very prevalent and only increasing in nature. So this is stuff you're going to come across every day. So stay tuned, subscribe, like, whatever it is, so that you can stay on top of things. All right, let's first talk about panel testing. Do not order food panel allergy testing. Almost never are you going to order this, especially in primary care. The thing to keep in mind about allergy testing, especially food allergy testing, is that there is a lot of gray in this area. It's not like when you're figuring out, does someone have diabetes or not? You order a blood sugar or an A1C and it's either high or low in the diabetic range or not. Whether you're talking about hypertension or not, you measure their blood pressure a couple times and know whether they're hypertensive or not. High cholesterol, same thing. It's yes or no sort of thing. Easy, clear-cut answers with the diagnostic tools that you have, but it's not the same in the allergy world, okay? A positive test doesn't always mean clinical reactivity. There's a better negative predictive value of the test. So if you think someone might be allergic to something and you do the testing, a negative test has a very good negative predictive value, but the positive predictive value is not very good. So we always have to correlate that with our clinical findings. Does the patient have a reaction? Okay, food allergies are immediate hypersensitivity reactions. What that means is patients will usually have symptoms within minutes of eating the food, occasionally 30 minutes, an hour, 2 hours, but we're talking about mainly immediate hypersensitivity. So there is no reason for you to do a food panel test looking at foods patient has already tolerated. You don't need to check for milk, egg, wheat, soy if the patient is eating these foods and you're only worried if they have a cashew allergy. Now, sometimes we will check food panels when we're looking at highly cross-reactive foods. So if someone does come in with a cashew allergy, I might want to know, are they also allergic to the other tree nuts? If someone has a shrimp allergy, I might also want to know if they're allergic to other foods there as well. So that is the only time we want to do food panel allergy testing. We'll talk more about respiratory panels, which might actually be useful.